November is Lung Cancer Awareness Month, and while the number of smokers has declined over the years, it is still the leading cause of lung cancer. 1 in every 15 people will be diagnosed with lung cancer in their lifetime, and lung cancer is by far the leading cause of cancer deaths among both men and women. Dr. Emily Tanzler and Dr. Medhi Moezi with Cancer Specialists of North Florida, both here to talk with us about how you can get screened for lung cancer early on with some new technology. But I want to start with some encouraging news that was just released. Basically, the news is in this new report, the number of lung cancer cases diagnosed has dropped, and encouraging news about the 5-year cancer survival rate. Who wants to tackle that?
Exactly. So lung cancer has always been a leading cause of cancer deaths in both men and women. And in 2005, it actually peaked. But what's so encouraging about it is that the number of deaths has actually dropped dramatically since then. And a lot of that is attributed to this early screening detection program with CT scans. And
the CT scans, this is a relatively new technology, and it should encourage people to go out there and get screened, especially if there is risk within the family and a family history.
Right. So there are several risk factors. If you smoke for a total of 30 pack years, that means if you're smoking a pack a day for 30 years, or if you smoke 2 packs a day for 15 years, that qualifies you. The at-risk group are more people at 50 to 80 years of age, but again, if you're younger and you smoke more than 30 pack year history, you have to come in. You don't need a referral, and we can do a low-dose screening, which has about 14 times less radiation exposure than a chest X-ray or a diagnostic CAT scan. And if I want to compare this, if you look at a chest X-ray, which failed to show any survival benefit, it looks like that you look at your old grandfather's black and white TV, and now we have an 8K high definition CAT scan that can flip through your lung like pages on a book, and we can look at every tissue plane and find these areas of problem. And if you have a nodule, now we have technology that we can go after those tiny nodules and detect the cancer early. And those patients, we can cure them. There's 20% survival in the early diagnosis if we can find these patients early, and the CT screening, the low-dose CT screening, is the key. We can offer that to patients. You don't need a referral. You can walk to any of our offices at Cancer Specialists of North Florida, and we can arrange to do it, go over, and if there's a problem, then we do the rest of the workup, but you're already in the system.
So the answer is the earlier the better. And you know, there's a lot in the news about vaping and e-cigarettes these days. You know, you talk about cigarettes and you talk about, you know, smokers and how that's the leading cause of lung cancers these days. Vaping, is that a big problem when it comes to lung cancer?
I think that what the population needs to know is that there needs to be caution. We don't know enough about this yet, and I think we're starting to see that. There has been obviously cases that we're seeing where patients are very, very harmed by that. And the FDA and the CDC has come out and issued these warnings that there is caution. There is, although in much smaller levels, there are cancer-causing properties in these devices. And yes, they are less than cigarettes, but I think that there's a lot more that we need to learn about it. And I think that the population should caution about it and think about smoking cessation completely. And there's a lot of things out there to support the community and the patients and programs to go to help you completely stop smoking in any way.
And that said, up until, what was it, 1962 in the Surgeon General's report, we didn't know about the impact of cigarette smoking.
At all.
So better safe than sorry.
Exactly.
All right, for more information on scheduling a CT lung cancer scan or to make an appointment, you can visit the CSNF website at cancerspecialistsnf.com or call 904-538-4490. And if you or a loved one are trying to quit smoking, we'll post more info about the Great American Smokeout, which is coming up November 21st, and resources on newsforjax.com. Thanks.